I like outdoor activities, hiking, um, hunt for wild mushrooms in season, hunt, fish.
Kurt Myers is active outside of work, but also at his job as the Food Services Director for Reading School District. He oversees meals for 23,000 students daily. But over the span of 6 months, a hernia began to slow him down. He went to see Dr. Michael Aboud.
Seemed like it would come and go as it pleased. I referred to it as my bulgy, and when it started to become problematic, that's when I sought the counsel of the doctor. It became problematic when it started to limit my activity. There was pain associated with it off and on, and I wasn't able to keep doing the things that I like to do or have to do. It was cramping my style.
Kirk had presented to the office with fairly typical symptoms consistent with an inguinal hernia or a groin hernia. Typically, those symptoms would include a swelling, a bulge, or some combination of discomfort in the affected groin.
I really had no questions. He explained it in such a way that was very understandable what was wrong, and that if I didn't get it fixed soon, I was going to make it worse, which I had been doing.
After a full discussion of hernias and options, in Kirk's situation, we elected to proceed with an operative repair. And jointly, we felt that a robotic repair of the inguinal hernia would provide him with the most benefit. So essentially, the goal of that process would be to repair the hernia to resolve the symptoms he was having presently and to prevent the hernia from getting bigger and causing more problems down the road. In terms of the details of the procedure, essentially the hernia repair is achieved through making 3 small incisions, 3 8mm incisions that are made in the abdominal wall. It's done under anesthesia, so he didn't hear, see, or feel anything during the process. He got checked in, came into the operating room, went off to sleep with the assistance of our great anesthesia team. We were able to do our procedure using local anesthesia at those small port sites to minimize any discomfort. And then the actual operative repair was actually done from inside the abdominal cavity. The hernia sac was reduced or pushed back into the abdominal cavity. The actual hole or the weakness in the muscle layer, the hernia itself, was repaired with a piece of mesh. And then at the conclusion of the procedure, the small robotic trocars were removed and the incisions were closed with dissolvable sutures. So there's no sutures, staples that have to come out. And then he's taken to the recovery room to recover.
For Kurt, it was a quick and easy procedure.
Professional and compassionate. They were very compassionate too, which struck me.
And just 2 weeks later, he's found welcome relief.
I have no discomfort right now, either from the surgery or from the hernia. It's really wonderful.
One of the advantages to the robotic surgery is a quicker recovery with less post-operative discomfort. In Kurt's case, he was able to make it through his recovery with just over-the-counter medication. Liz, back to you.
Thanks, Christina. Hernia repair is among the most frequently performed surgeries in the country. Dr. Aboud checks in with us now to follow up on Kurt's story and to discuss other specialized surgical procedures.
Dr. Aboud, thank you so much for joining us. Kurt is feeling so much better after surgery, and he really had some wonderful things to say about Penn State Health St. Joseph Medical Center. How common are hernias like the one he had?
Well, quite common, actually. Men are typically, on average, about 8 times more likely to develop an inguinal hernia than women, and a male's lifetime risk of developing an inguinal hernia is about 25%. So he falls right into that population.
What other types of hernias do you see, and what are the treatment options?
Well, the treatment options for hernias in general are to observe them, consider watching them, or the consideration is for operative repair, either by open or laparoscopic or robotic techniques. In addition to inguinal hernias or groin hernias, we see umbilical hernias, or otherwise known as a hernia at the belly button region. We see patients that can develop what's called a ventral hernia, which is a hernia that's above or below the umbilicus in the anterior abdominal wall or the ventral surface of their abdomen, or potentially an incisional hernia that's been developed as a result of a surgery that happened previously.
Let's talk about how the patient benefits from minimally invasive surgery.
Yeah, so when we discuss treatment options, obviously patients want to know how this is going to impact their lifestyle and the recovery. Typically, we offer both open and or minimally invasive operative interventions. The advantage theoretically for a robotic or laparoscopic approach is a quicker healing time and less recovery and getting back to activity or work in a quick fashion.
What other types of surgical procedures do you do at Penn State Health St. Joseph Medical Center?
Well, personally, as a general surgeon, we like to say we do everything inside the abdominal cavity. So in addition to hernias, I do a lot of diseases and disorders of the breast, both benign and malignant cancerous. But as a generality here at St. Joe's, Penn State Health, orthopedic surgery, general surgery, vascular, plastics, cardiothoracic, we really are able to take care of the full gamut.
So let's talk about pain management after surgery. How do you help patients control their pain after they go through surgery?
Well, I think it's a big question, especially in this day and age. I think it's about setting expectations with patients ahead of time in terms of explaining what the process is and what's going to happen. With setting those expectations, we really try to upfront maximize opportunities to minimize pain. So by using plenty of local anesthesia before we make any incisions, with the assistance of anesthesia, both with narcotic pain medication and other anti-inflammatory medications. And then certainly in terms of recovery afterwards, we offer narcotic pain medications if necessary, but try to encourage patients to minimize those and lean more towards anti-inflammatory medications, as well as other options to get back to their baseline as quickly as possible.